So let me start out by asking you a personal question
Sure.
About cancer survivorship. I have read that your parents are both cancer survivors.
Yes, my father was diagnosed when I was 12 with colon cancer, and my mother when I was 30 with pancreatic cancer. So very much my life has been shaped by being in the family of cancer patients and survivors.
Yeah. As you bring that to your work, how does it affect you in your work?
Well, it's clearly an inspiration and motivation, and my father, being a Chinese immigrant, and my mother, African descended, made me very aware of the issues of culture and ethnicity and spirituality and the complexity of cancer survivorship and its outcomes that's influenced not just by the cancer, the illness itself and its treatment, but those contextual factors, and it really informed my work and my advocacy work with ethnic minority and underserved and underrepresented populations.
What are the important messages, lessons that you've learned from your work in terms of culture and cancer?
Well, I want to start off by saying it's both cultural, so they're broad cultural factors such as language and beliefs about cancer, even what are some of the causes of cancer or why people get cancer. That said, we do need to think about the individual as well. So be careful not to, peg people just because they are Chinese American or Chinese or African American or African descended to assume that they ascribe to those beliefs and practices. But one of the things that we did find is that African Americans tend to have a very spiritual approach to their cancer. And so it's important to sometimes incorporate that, if we can, in our supportive care and even in the medical care, because oftentimes the patients will think about integrating both what the oncologist brings and the medicine, as well as what spirituality brings to the healing. And so oftentimes they may think of the physician as being a vessel of bringing that healing and medication because of their spiritual beliefs. So it's not just dependent on medicine alone, but really an interaction of both.
So that's actually sort of a good example about how culture can actually promote the therapeutic process.
Yes.
Are there any barriers that for example, in the cultural background of people that are Asian descent or African American, any barriers that come up?
Well, I think it's important for the treating group to ask, what are some of the cultural practices? Because yes, it can be a barrier to adherence to treatment. For example, one might think, well, I need to pray first, or delay the treatment because I need to understand it from a spiritual perspective and find meaning, which is an important part of the healing. But you want to, with cancer, we know that early initiation of treatment is critical, right? So you don't want to delay that treatment and adherence. So I think asking the patient and how that might affect their care or their relationship with you, rather than thinking it's not going to be there, and of course the physician has all the authority, it may not be that case. And so I think many patients would be open to discussing if it's brought up, as opposed to sort of both being swept under the rug and assuming that the patient is always going to adhere to the treatment, because there may be cultural factors, there may be spirituality factors that may influence the decision making. That's very, very important. And the family could influence that decision making as well. So sometimes bringing in the family, which culturally may not always be a part of the treatment, because it's a patient. We think about patient privacy, let's discuss it with the patient only, but in many cultures the family is part of the decision-making process. And so talking to the family, asking who is the health decision maker in the family, and bringing in that person. It may or may not be the spouse or the partner. It could be an adult child as well, or an older person in the family, an aunt or a respected representative. So I think having the dialogue and being open to learning about the patient's perspective is critically important to quality of care and adherence to our treatment.
So from the patient perspective, what are, serving as an advocate for patients, how can they bring, if their doctor doesn't bring that up or their healthcare team, any advice on what they can
Yes.
do?
Well, one of the things that we're doing is very important piece of training patient advocates from the culture. Oftentimes they may be survivors themselves because they know both the experience of the culture as well as the cancer experience. Some of them are professionals. So we have been working with community advocacy organizations to train navigators and to be a part of that bridge with the healthcare team and the patient to help negotiate the sort of cultural perspectives and the other components, the contextual component, so that care is really for the whole person and not just the cancer.
Yeah. What are some good words in terms of asking, and I asked as a clinician, asking someone about their spirituality, or someone saying, "Doc, I want to," vice versa, what are some words that a patient might use?
Yeah, saying that it's very common for cancer patients to incorporate spirituality or to try to understand and make meaning of their cancer from a spiritual perspective. Tell me your story. And with that kind of opening, a lot of patients will be very open to dialogue because it's not a sense of condescending or I don't think that would be an important piece. And just asking that question would open up the patient. And not just from the spiritual context, but also from the relationship. That my doctor cares, and he or she wants to know, and so that can be a beginning of a very, and we know with cancer, the complexity of the treatment, a long-term relationship with that patient.
Sure. Do you feel, that the impact of cancer is, and let's talk about during treatment and then after treatment, is the impact on an African American woman, or man for that matter, different than for other groups?
I think there are some social contexts for African American women that may be a little bit different. We have a higher proportion of women who are unpartnered, and we know from lots of the work that Matt Lascalzo at City of Hope and others have done that partner support is very, very important, and family support. So the support structure may be a little bit different because they tend to be unpartnered, around 60%, as opposed to for other population, maybe 40% are unpartnered. So you have a higher proportion who would rely on family support and network support. So from the church and other community and civic organizations could be very important for African Americans. And for Asian Americans, it's the family, and for Latino Americans, it's the family. And very much reaching out to the family network for support. And it may not be just the partner, as would be more common, and I know I'm making generalizations for European American women, but really including sometimes the children for Asian families could be very much part of the support structure. And for the Latino family, it may be the comadre or compadre. It's the fictive kin, so it's people that may not be blood related, but are part of that strong family network.
A man or a woman has been treated for cancer, and then there's obviously that's a very acute period of time, a lot of attention.
Yeah.
Treatment ends, people then go back to normal or a new normal. How is that experience, again, special or different for people of color?
It's particularly important because I think the unknown is so profound. And you're getting all this attention, like you said, and then treatment ends. I think that's the point where we need to talk about supportive care and giving them back to the community and the network that they have used for other kinds of stressful situations in their life. And it could be the church, it could be a civic organization. I know of African Americans serving support groups. So in California, several networks of grassroots organizations have built up, and they partner with the medical care team. And I think that's so important to tell the patient that it's okay to go back to your support network, and actually, if the care team could be informed about the number of resources that's available, that the in-language support services, then they can give the referral back to the patients to go back to those supportive communities that's built around that specific ethnic group or language group, and so they can get the support in language that they need.
So I'm going to ask you two related questions. One is for the caregivers, medical people.
Yes.
The other one is for patients and families. But this is your field. You've done a lot of research. What advice, again, sitting here, would you give to clinicians like myself in terms of how to be a really good doctor or a really good nurse for people of color?
Well, there are several organizations, like I mentioned. So I think going online, if you're not familiar with the communities in your network, going online and finding out who are the support organizations, and many are formed around a specific ethnic group. So there may be a Chinese American breast cancer support group, there may be a Latina support group, an African American support group. So find out who they are and just reach out to the leadership of that organization. They oftentimes want to partner with the medical group because you could be invited to give a presentation at their support group. It builds a network of care that extends beyond the hospitals and the cancer centers. So I would highly encourage the practitioners to reach out to the communities. I would encourage the community advocates to reach out to the practitioners and say, here's what we have to offer, can I meet with you? And we found that both parties are actually willing to talk, but sometimes they have not been brought together, so someone has to make that reach out and extend the hand to those community organizations. And I think both find that they would interact with each other and can support each other's work. So when the initial care is done and that scary time starts with survivorship, and the initial survivorship and the patient doesn't know, then the physician can say, here's an African American support group, here's the number, if you would like, I'm not saying you have to, but if you would like, please reach out. And then sometimes you may not want to reach out in the first month because you're still dealing with some of the side effects, but you may find even 6 months or even a year that need might come up because, survivorship, different kinds of, stress related to the cancer experience can emerge at different times. And giving that permission to the patient to reach out when they feel comfortable to do so.
You also, I think, gave some really good advice in terms of language, which is, how can clinicians basically ask people,
Yes.
What are your needs? Tell me your story.
Yes.
So, from the patient perspective, again, if you, talking to a woman or man just of color just diagnosed with cancer or finishing treatment, what advice would you give them about making their cancer experience as easy as possible and as, hopefully less stressful than it might be?
Yeah. Well, I think one of the important things is really to look at the whole person. So to talk about, the follow-up care, that would be important. I really would like to see you, and that's important. The surveillance that the person would need, but also giving a survivorship care plan that we know has been recommended by the Commission on Cancer. And that survivorship care plan, the way I think about it, that it's really a shared care approach. So the physician can talk about the treatment and the side effects or the potential side effects and the surveillance that the patient would need. But they could incorporate psychology and social work and spiritual care, health practices that may need to be changed. So talk about nutrition, sleep hygiene, care for the whole person, so that way exercise could be a part. What would be some of the things that would be important in terms of body movement? Can really address depression in cancer patients, body image issues. Exercise is a wonderful sort of therapeutic alliance to the patient and the follow-up care that they would need. And also, telling the patients about the social support. So as much as it could be difficult at times to go back into the social network that they had, before the cancer, and doing that sooner than later actually could be very, very therapeutic and healing. And it's something that we deal with in psychosocial care, and I'm part of the board of APOS, the American Psycho-Oncology Society, and we really want to encourage patients to live life fully after cancer, and to encourage that patient to, even when they're not feeling, the most energetic. But that may be the time to reach out to a friend and say, you know, I'm not feeling so well, and really I look, you know, horrid today. But can you please come over and just have a cup of tea? And so it's encouraging that patient to reach out even in their moments of not feeling, you know, well and feeling gloomy, and that's the time to reach out and do it in a very supportive way, that happens to patients, and not make it seem that this is isolated and this is just you.